Hello, everyone. Welcome back to St. Louis Teens. Welcome to our series on COVID-19 heroes, which is a celebration and appreciation of everyone who is serving the community right now and battling the pandemics on the front lines and people among us who are risking their lives to save the lives of others. So, our hero today is Lucy Sadl, who is an ICU nurse. Lucy, we thank you very much for your service to our country, our fellow citizens, our friends, and our loved ones who are in hospitals right now. And we're very grateful for the service that you do, which we understand comes with stress, sacrifice, and risk. Lucy, you
Yeah.
are a hero.
Yeah, absolutely. Thank you.
All right. So, Lucy, we would like to know a little bit about how it has been for you on the front lines. What has your experience sort of been?
Um, I've been an ICU nurse for about 23 years, and now I work as a nurse practitioner full time, but I still take on shifts in the ICU in one of the local hospitals here. And recently I have been taking care of COVID patients in the ICU, which are most likely the sickest of the sick that are experiencing COVID and really can't be at home because they are not breathing well, requiring large amounts of oxygen, and cannot be supported in their own abilities to breathe. So, yeah, everything that you mentioned, it's very stressful for coworkers. The risk of exposure is great. Having to wear the limited amount of protective gear that we have has been a challenge. It's also very uncomfortable to wear for the 12 and a half, sometimes 13-hour shifts that we are having to do. So, aside from the acuity, which we're very used to, the stress levels that we're very used to in the ICU, the most challenging has been the influx of patients in a kind of a quick turnaround time. We just are seeing more and more coming through the doors, and then having to kind of react in a quicker way and having to deal with limited amounts of PPE. It puts everybody on edge because we want to be able to care for these patients in a safe manner with the proper gear. And when you don't have that, you are just very aware of it, and you don't want to put your own loved ones at home when you do come home at the end of the night of your shift. So those have been great challenges. Also, the risk to coworkers, doctors. I feel like if we don't keep ourselves healthy, who's going
Yeah.
to be able to care for these folks that do come in, that need ventilators, that need multiple drips, that need blood pressure support, that need to.
Yeah, well, again, thank you so much. I know it's really difficult. So you did sort of mention about the influx of people who are
Mhm.
coming in. Have you seen maybe some sort of decline or maybe becoming stagnant over the past few days, or is it continuing to
No,
increase?
no. I keep in touch. Like I said, I do work full time as a nurse practitioner, and this job, I do keep in touch with coworkers and friends that are ICU nurses in many of the hospitals around town, and it's still continuing to be an issue and numbers rising. So we're just trying to just rise to the occasion and meet the challenges that face us. But it's difficult when people can't make their shift or are feeling ill or self quarantined. It stretches the existing staff to their limits, and I've seen people just really wanting to not work, understandably so. So some of us have, as you can see in the community, people are making their own masks or donating supplies. I know our ICU doctors went out and got us face shields from a hardware store. So it's hard to work when you're piecing these things together. And we would, like to have more of gear that is self-contained and can be not just reused, but properly cleaned
Yeah.
and all that good stuff. So,
And sort of building on that, what would your advice be for our viewers and our country at this time?
The biggest advice I think is what everybody that is maybe watching the news, just making sure that they get their information from proper sources, not just on random sites on the internet or from what you hear from somebody in your neighborhood. Is follow your CDC guidelines. Just please take this very seriously. I think a lot of people think that it's a joke, and it's not. This virus is a killer. Unfortunately, some of the patients that I've cared for have passed away after a battle with this virus. And so, of course, we do everything we can to save lives. And it's sad when your efforts after 10 days on a ventilator, 8 days, whatever it may be, it's different for every patient. Just take this social distancing seriously when you're having to go somewhere, the grocery store or a doctor's appointment. We ask that you limit your time or maybe make arrangements to do that later. The things that are just essential, wearing your mask and gloves, sanitizing, and just taking it seriously. Like I said, I've been a nurse for 24 years. I've never seen anything like this, and it makes people very ill very quickly. And if they have existing health conditions, it's a challenge to not only keep them alive, but to see our efforts improve their conditions. So I've personally stayed away from my own mother for over a month, and when I work, I distance myself from my children. I know coworkers are living in their basements, in RVs, in their driveway, campers, and just, still coming into work, but trying to limit our risk exposure to our own loved ones. So just take it really seriously. Wash your hands, wipe down counters and things in your own home. So everything that you've been hearing as far as what the CDC is recommending. And then hopefully one day, if there is a vaccine, as we tell people to get a flu shot every year, we would probably recommend that people get the vaccine when it does hopefully come out. So
Yeah, we definitely hope to follow your advice on, taking this seriously, following, the guidelines, making sure you're looking at trustworthy sources, and, overall trying to limit the effect of this disease. And, we thank you for your time and service during these difficult times.
Thank you. Thanks, guys. And hopefully it helps. And, it's not just doctors and nurses. We work as a team with everyone there at the hospital, and it's everybody's coming together as best as they can. But it's a challenging time, and we hope that we can get more equipment, and we hope that people can stay healthy to show up for their shifts, because that's what healthcare is. We're trying to help the people that need us, and it's tough if we're ill ourselves. So everybody just stay home and stay clean and we're doing the best we can.